do the IV push demonstration. It's going to be through the patient's port, through the actual IV line, whether it's compatible and incompatible, and we're also going to do the CDC line. For our medication, of course, we prepare our medication in the med room. We're going to have our appropriately labeled meds with our dosage that we have calculated and that we have compared to the patient's MAR. We're also going to do our checks at the med room, and then we're going to do our last check at the bedside. Once we have completed our check and we've drawn up the appropriate medication, we're going to take our labeled medication and our needed flushes to the bedside. Once we get to the actual room, we're going to introduce ourselves, verify our patient's identity, and verify the drug once more to the MAR. We're going to perform hand hygiene and put on our gloves. We're also going to ask the patient if they have any allergies and assess their pain level as well. So once we have assessed that they don't have any allergies, that they haven't had any reactions to this medication, if they've taken it before, after we've done our vital signs and everything, we're going to go ahead and take our alcohol swabs. And we're going to clean our port. We're going to have our flush ready. For the port nearest to the patient, we're going to go ahead and flush with 2 mLs. So we're going to connect, check for blood return, and once we see the blood return, we're going to go ahead and administer the 2 milliliters of flush in a push-pause motion. So after we've checked patency and flushed, once again we're going to clean with alcohol, and at this time we're going to administer our medication. We will perform our last check right before administration right now. We connect to the port and administer the medication in a push-pause motion, whether it be over 5 minutes or longer or shorter. Once we have administered our medication over the time that has been determined to be correct for the medication, we remove, clean once again. Once it's dry, we are going to go ahead and flush again with our 2 mLs in the same way that we administered the medicine in previous flush with the push-pause, push-pause. After this, we can go ahead and replace the cap if the infusion was kept locked. If the solution is incompatible while we are doing our medication, we're going to go ahead and clamp this part and never let go. We're going to stop the infusion and we're going to clean our port, allowing it to dry and not letting go of the other end. If it is a incompatible solution, we are actually going to flush with the entirety of the 10 milliliters. So we're going to push pause per each milliliter. After that, we will wipe the port once again and administer our medication push-pause over the span that is appropriate for the medication. After that, we remove, clean our port once more, and go ahead and flush again with the 10 mLs in a push-pause motion. After that, we can go ahead and unclamp and restart the infusion. If the infusion that was already running has been determined to be compatible with our medication, we're simply going to clean once again, and instead of flushing with 10 milliliters, we're going to flush with 4 milliliters. So after cleaning, we're going to do our push-pause with 4 milliliters. We will clean the port once again. When it's dry, we go ahead and put in our medication. And we're going to do the push-pause, push-pause. After that, we clean our port and flush with 4 milliliters again. Push-pause per milliliter. And that is how we give our IV push through the IV line. Lastly, for our central lines, we're going to assess the site, and we want to make sure that it is patent. So we are going to flush with 10 mLs after we do the blood return. We make sure we clean. After we've connected the flush, we're going to go ahead and unclamp, check for blood return, and then go ahead and insert the 10 milliliters in a push-pause motion right after we get the blood return. Once we are done with our flush, we go ahead and clamp again so that the blood won't just gush out when we remove the flush. After this, we clean our port and we attach our medication. We go ahead and open our port. And we are going to administer the medicine over the time that is determined in a push-pause motion. After this, we're going to go ahead and clamp. We remove and clean our port once again, and we're still flushing with the 10 mLs. But this time, we're going to do the push pause, and once we get to the last 0.5 milliliters of our flush, we're going to go ahead and clamp the axis closed as we push the last 0.5 so that we can create the positive pressure in the port. We remove it and either cap it or go ahead and clean it with the HEPA. So for each medication, we're going to check the time that they're supposed to be given at. And we're also going to check to see if they need a diluent. And we're going to assess that the patient does not have any allergies for the medications that have been prescribed or any similar medications in the same family. If they've had a reaction to that before, we're going to make sure that we determine that before we actually give it to avoid any complications. So we're going to go ahead and document their vital signs, how they reacted to the medication, if they felt any flushing or redness or pain at the site while it was being administered or afterwards. And that is pretty much for our documentation.